Have you ever opened your eyes in the morning with a dry mouth or cracked lips after 70? Many older adults ignore this. They drink a little water, put on lip balm, and continue with the day. But when your body gives you the same sign again and again, there is usually a reason behind it. After 70, even small changes can point to something deeper. In this video, we will look at 6 serious reasons your body may be sending this signal. This is not about panic. It is about paying attention early so you can protect your health, your memory, and your independence. Stay with me, because one of these causes is often overlooked, even by experienced people. A very common reason for waking up with a dry mouth after 70 is ongoing dehydration. As the body gets older, the feeling of thirst becomes weaker. In younger years, dehydration is easier to notice. After 70, many people do not feel thirsty, even when the body needs more fluid. That is why mild dehydration often goes unnoticed. Saliva depends on proper hydration. When the body is low on fluids, it tries to save moisture, and one of the first places this appears is the mouth. Dry lips, sticky saliva, and that rough, dry feeling in the morning are often early signs. But dehydration is not only uncomfortable, it can also affect blood pressure, kidney function, balance, and mental sharpness. It may even raise the risk of dizziness and falls. A simple solution is to drink more water earlier in the day instead of taking most of it at night. Many seniors reduce fluids because they worry about getting up to use the bathroom. But cutting back too much can make things worse. A better approach is to spread fluids through the day and reduce them closer to bedtime instead of avoiding them completely. Another major cause is medication side effects. By the time many people reach their 70s, they are taking more than one medicine. Blood pressure tablets, allergy medicines, antidepressants, bladder medicines, and some heart medications can lower saliva production. This is very common in older adults. The danger is not only the dry feeling itself. Saliva protects the teeth, gums, mouth, and throat. When saliva drops, bacteria grow more easily. That can lead to cavities, gum disease, mouth irritation, and even trouble swallowing dry foods. Poor sleep from constant dryness can also affect memory, mood, and stability during the day. The solution here is not to stop medication on your own. Instead, review your medicines with your doctor or pharmacist. Sometimes a dose change, a timing change, or a saliva support product can help a lot. If you wake up dry every morning and take several medications, this is worth discussing. Dry mouth can also be an early warning of high blood sugar. As people age, the body may not handle glucose as well as before. Even someone who never had diabetes earlier in life can develop blood sugar problems later on. When blood sugar stays high, the body tries to get rid of extra glucose through urine, and this pulls water out of the tissues. That often leads to dehydration during the night. Morning dryness may happen along with extra thirst, frequent urination, blurry vision, or low energy. Over time, high blood sugar can affect the kidneys, eyes, nerves, and even brain function. That is why this sign should not be ignored. A helpful step is to have your blood sugar checked, especially if dryness comes with nighttime bathroom trips or fatigue. Better meal choices, regular monitoring, and following medical advice can often improve both hydration and energy. Another possible cause is sleep apnea or nighttime breathing problems. As we get older, the throat muscles can weaken. This can narrow the airway during sleep and cause mouth breathing. When you breathe through your mouth all night, the mouth and lips dry out badly by morning. But the concern goes far beyond dryness. Sleep apnea can reduce oxygen during sleep and increase the risk of high blood pressure, heart rhythm problems, stroke, daytime fatigue, memory issues, and mood changes. If dry mouth comes with loud snoring, morning headaches, poor sleep, or daytime sleepiness, it may be a warning sign. The solution is to get evaluated instead of guessing. A sleep assessment can identify whether breathing problems are part of the issue. Treating the breathing problem often improves both sleep quality and morning dryness. Persistent dryness can also come from gland or autoimmune problems. In some cases, the glands that make moisture do not work properly. When that happens, the dryness may continue through the day, not just after waking up. You may notice dry eyes, trouble swallowing dry foods, cracked lips, fatigue, or even joint discomfort. This matters because long-term dry mouth can damage oral health, reduce taste, lower appetite, and lead to poor nutrition. In older adults, that can quickly affect strength and energy. The best solution is to pay attention to patterns. If drinking more water does not help and the dryness stays severe, it is important to talk with a doctor and get checked. Ongoing dryness is not something you should simply accept as normal aging. The final reason is early kidney strain. The kidneys help control fluid balance and keep hydration stable. When kidney function starts to decline, even a little, the body may struggle to manage fluids properly. That can show up as unusual dryness in the morning, along with night urination, mild swelling, or tiredness. Kidney problems often develop quietly. By the time obvious symptoms appear, the condition may already be worse. That is why early signals matter. Kidney health is also closely connected to blood pressure, hydration, blood sugar, and medication use. Many of these causes are linked together. The solution is to keep up with routine checkups, stay hydrated, and ask for kidney testing if dryness keeps happening with swelling, fatigue, or frequent urination at night. Catching problems early gives you more control. If you're watching Senior Health Tips, remember this. Waking up with a dry mouth and cracked lips after 70 may look small, but repeated symptoms should never be dismissed. It may be dehydration. It may be medication side effects. It may be blood sugar changes, poor breathing during sleep, gland problems, or early kidney strain. What matters most is not ignoring the pattern. Health problems often do not begin with a loud warning. They begin with quiet signals. Morning dryness may be one of them. The goal is not fear. The goal is awareness. When you listen early, you give yourself the best chance to stay strong, clear-minded, and independent.